Healthcare is beyond the reach of the vast majority of the Kenyan rural population because of their poverty.
It's something you cannot really miss. You can see very easily it's still in our community. Out of 16 or 18 people, one person has a job and the rest 17, they don't have a job.
The poverty of this country is still high at close to 50% of people living below the $1 a day.
Just thinking about the poverty levels is quite difficult for patients who are in rural areas to reach to a facility. Not because they're not a facility, but sometimes because they don't even have the bus fare to go, to the health center.
One of the challenges with so many hospitals and the community. I don't know if you're done. Just give me just 1 second.
Really, you can't run away from death. It has to happen. Much as it's something that scares, it's something that is, we fear it.
Our culture, we don't like to talk about death a lot. We don't like to say that somebody's going to die very soon.
The healthcare system in Kenya is still not well developed.
We build our hospitals, but we don't put enough beds and rooms, and we don't have enough healthcare providers.
The doctors are very few, patients are very many.
I know that most patients don't even get to see a healthcare provider. Our hospital is supposed to take 200 patients, taking 500 patients. We have 2 patients, sometimes even 3 patients sharing a bed.
Others sleeping on the floor of the hospital, and the nurses are simply too few to handle that. And then, of course, the doctors are not enough.
Why die like a dog? Is it because you are poor?
I've always known that I've not come to Africa to fix what's broken here, but to be a part of joining the team of Kenyans here who do care and who do want to make a difference for their people.
Kenya is a community society. We live as a community. And when somebody dies, we stop everything in the society. We stop farming, we stop all our activities, and we can to go and mourn. You'll find at least sometime 20, 30, 50, 200, 500 people coming to the deceased home to show that they were mindful of this person.
Hope means a lot of things. When I used to work with patients, patients thought for them hope would mean that I'm saying that you're going to get cured. But sometimes hope for a patient might not necessarily mean you're going to get cured. It means that there are other things that can be done to support you during your illness. And that's really what hospice is about, is that you foster hope into a patient's life.
I had been living in this village of Kipkaren for about 5 years, doing a lot of HIV work. There were numerous factors involved with just realizing the huge gap that was remaining for hospice care, that people were suffering and experiencing so much pain, and it was something that wasn't being addressed at all within this area, and I was tired of watching that suffering. My name's Julie McGowan Voigt, and I'm the founder and international director of Living Room. Living Room is a 24-bed hospice facility. It's about an hour drive through both paved roads as well as unpaved roads. It's far from town. It's far from where most people would choose to put a hospital or to do treatment. This is where the poorest of the poor, they live, and they don't have access. They can't afford to be traveling to town to be able to get treatment. And so because we had trust with the community, this is where we chose to build the hospice. The connection is the hospital that said they'd like to refer the patient to Kimbilio.
And the way they came to know of our Kimbilio is that I was there one time visiting another patient, and I left my number there to the doctor and told them that in case you get any patient that needs palliative care, and so you inform the family, and then we can pick up from there.
Okay.
So this is as a result of that visit.
No, that's great.
Yes. I'm Daniel Morogo, and I'm a social worker at Kimbilio Hospice. As a social worker, you are always the first contact with either the family or the relatives or the hospitals for them to really know what do you do for a patient that has been referred for palliative care.
The patient's gonna come from East 10 District Hospital, which is about a 2-hour drive from here. So we don't work with them all the time, but I think just the more the word gets out about the services that are available, because there aren't other hospices like this one nearby, then it allows for more patients to be referred here.
We have made an arrangement that we come there tomorrow and pick the patient tomorrow there. Yes, Daktari. And I think we will talk more and discuss more about the patient.
Because he's already gone through the medical care system, they're referring to palliative care, then it's clear that they're saying there's not more they can do in the hospital for him.
Palliative care is care that deals with quality of life for patients who have life-threatening illnesses.
Patients here want the same things that patients in the West want. They want somebody to take care of them, to love them, to tell them the truth, and to help them and not abandon them. And so the key principles of palliative care in Kenya are the same. The difficulty here are the resources. With such resource constraints, lack of morphine availability, lack of skilled providers, physicians who know and are willing to prescribe morphine, makes dying in Kenya extremely difficult.
Barnabas is a man with advanced cancer with metastasis. It started in his esophagus and it spread to his lungs and brain.
At the hospice, there is a 24-hour kind of attention, and it is focused on the person.
So you find that the hospice really has more time and will focus on things that might not interest the hospital team, like talking to the patient and just counseling them, looking at the spiritual aspect of care, looking at all those things that are very important for the patient, that the patient feels are important for them.
He had received minimal treatment, but now was having a lot of pain towards the end of life. At the hospital, he didn't have access to morphine or to other medications.
What we want is, we want Barnabas to be pain-free. And we have what it takes to make Barnabas be pain-free.
HIV has been, this huge pandemic that has ravaged so much of Africa, and Kenya has been a part of that and been affected by it in so many ways. We're a unique hospice, and that, again, many people see hospice strictly for end-of-life care, and I would say that that is more true for our cancer patients. But for our HIV patients, this actually serves as kind of like a shelter where patients who potentially will rehabilitate come. James first came to Living Room about a week ago, and he came because he's an HIV patient from the community, and our outreach team had gone to visit him and just saw that he was really sick, was vomiting a lot, and needed extra care than what was available in his home. And so he's been in the hospice for the last few days.
He's saying that he didn't sleep. He lacked sleep the whole night. My name is Rachel Toto. I'm the clinical director. I treated James in 2005 at a Turbo HIV clinic. He has deteriorated a lot. When we met the first time in 2005, he was a young man, very energetic.
It's what HIV has done to so many young people in Africa. Are his vital signs stable now? His blood pressure is back?
Blood pressure is back.
Okay.
But I want to check on his neck because he's complaining of severe headache now.
Yeah, okay.
Ngile kiungana. Masiku borwa. Ko 2008 kumela kweni.
Stigma is a big problem whereby people would not want to discuss freely about sexual issues, and once you've been diagnosed with HIV and AIDS, people will not love you, they will shun you, they will not want to associate with you.
When HIV treatment was brought to Kenya, there was a lot of education that was needed, multiple pills taken multiple times a day, because the way the virus works is if you don't take the multiple medications, the virus will mutate and then the drugs no longer work.
Nini ilikuwa imefanyika huko nyumbani huko unameza mzuri sana?
Kwa kumeza dawa ilimeza. Lakini mahali shida ilitokea daktari, kuna siku 2010 tarehe 7 kwa nataka kwenda Nairobi. Nikaambia daktari niongezee dawa maana mahali ninaenda sijajua vile iko na kuna mtu ameniita. Hakika daktari alinikataza. Sasa nikaona mimi ni mtu wa kujitafutia na hapa sitakuwa nyumbani. Sasa nikapiga hiyo sasa nikaona wacha niende nisione vile itakuwa. Nitarudi tu haraka. Hakika vile nilienda nilichelewa. Sababu kuna ule alikuwa gari yake ilichelewa kwa meli ilichelewa kuleta mafuta kwa pipeline.
So ulikaa muda gani?
Mpaka Februari. Kakuja kufika amba wakanipani kwa madawa kaniambia sasa ya tukue kwa madawa.
Ukakaa for how long bila dawa?
Nikakaa hiyo mwezi mbili. Nikarudi nikakaa mwezi wa 3. Miezi mingapi?
Miezi 2.
It is not only the giving of drugs when he goes to Ampath Clinic. It is also about many other things. So when he was told that he shouldn't have gone, there was much more than just for him to say, give me drugs and I will continue with the drugs.
One of the most frustrating, discouraging things for me is when we've been working with patients in the community and they decide to stop taking medications. And it's not that I judge them for that, it's just that it feels like we take steps forward and then there's a few steps back, and realizing the implications that are upon them for that is really challenging for me.
Since he's an Ampath patient, then he's due for his clinic tomorrow.
Okay, and then also because he was referred from the community versus the clinic, then we can get more of the records to know.
Yeah, because we don't know
what his CD4
the
count
CD4 count is.
CD4 is a marker that we often look at within HIV care. It's part of the white blood cell that HIV virus actually attacks, and the CD4 should actually be the cell that would kill the virus, but instead it overtakes it, and over time they begin to overtake all of them until there's no CD4s remaining, and you can't live without them because they're really the functional part of the immune system.
Matibabu iko sawa.
Iko sawa.
Na hata huduma naona iko sawa. Nashukuru Mungu. Sababu hata nyumbani sikuwa na chungu hivi. Lakini hapo mimi naona nachungwa natunzwa. Hata sabuni mmenipea. Nashukuru.
Asante.
Nashukuru, hiyo ni jambo la maana kabisa. Napata naomba tu msite kutenda hivyo.
Asante. Asante.
Ni gini sengabin ay sipur gini. Wow, malunan.
Sasa. Tapi jika maile nagere gina, kangunde jugityo. Akin metigero ko kwamane. Akin ang mat. Itu mat sabar moja kityo lesho.
Nyon kulen?
Itu ko mat kityo kulen. Ako name mat so nyo kityo natin ako. Paranda kityo natin.
Ang tiki kita ke mo Kweng nan masta.
Tiki chitwa kweng. Magenge. Amu bendi kulen. Amok komo. Kero yito ketyo. Ngwan kabisa. Ngwan. Bawasi. Lakini kasi kityo katay ke.
There wasn't really a model here for us to work from. You know, we were just starting and learning and trying and not trying to create, you know, an American model of hospice, but what does it look like in Kenya? What does it look like in this environment? Although Jacob wouldn't fit into, you know, the typical hospice in the US or other places, here in Kenya, there aren't places for someone like Jacob.
I was in a national hospital whereby nobody cares about patients. So the wounds developed because of no one cares about that.
My name's Edla Ananda. I'm married to Jacob. We were blessed by God with 3 kids.
Nairobi.
He was a teacher. He was a teacher in a high school. It was mixed, high and primary, but he was in primary section.
One night, thieves broke into Jacob's house and shot him, and he was paralyzed. Well, he'd been in a hospital for months, and while he was there, he developed bed sores, 4 wounds that medically we classify as stage 4, which means they were all the way to the bone and deeply infected and just a big mess.
Care was not so good. I can't blame them because patients were so many. So there was congestion, even on beds. There is a time he was even told to sleep down. You can now sleep on the floor. So the care was very tough. He was not turned regularly.
If frequent changing of positions was addressed, Jacob could not have developed such wounds.
It's nursing 101. If you don't turn a patient while they're in bed, then they're going to develop bed sores eventually. And they're incredibly difficult to treat and get rid of. Part of Jacob's challenge is that he can't feel them. If he laid in one position, let's say for 4 hours, then potentially the skin can begin to break down. It just goes deeper and deeper. It doesn't hurt, so he doesn't know to tell someone to help him roll over.
When we went there, we didn't know about bed sores because it was something new to us. So we were not told the position to keep on changing. So we just slept on one side mostly, And that's why I developed the source.
By the time he reached us, even though we could get the wounds clean, it's not possible for them to heal from the inside out. The risks of him developing infection is great. This can't go on for Jacob. He doesn't belong living at a hospice. He needs to go back to the community, but that's impossible until these wounds get closed. I want him to dream again because he's this man who's quiet, who thinks and listens a lot, who's brilliant and has so much left to offer the world. He's still young. One of the reasons the hospice was ever created is because of the times where I've gone to the hospital and the level of suffering that I've seen there. It's such a contrast to what I've known for all of my life.
Kingimi gai, kotomo itau kerichek ko kimi ngwonindo nyi.
Komi gaa?
Kotomo itau kerichek ko kimi nang bata.
Kimiten amu kimi barak kabisa.
Kimiten?
Kimi barak kabisa ngwonindo nikyo.
When Maggie first arrived to the living room, her pain levels were very high. It's just difficult often for people coming from hospitals to have adequate pain management. Margaret is this beautiful woman. She's a mother, she's a wife.
Kero tari ni ko ngwonindo amete kiro tugul ugemi no nambata.
Chito kebore tuona. Konyogi koi kinde ukocha. Kowektage. Nikiboibo.
After that treatment, the cancer reoccurred and metastasized into her spine and ribs. After experiencing a lot of pain and developing paralysis in her lower limbs, she was admitted to a hospital in Eldoret where the palliative care team that was there realized how much extensive care over time she was going to need, and so they referred her to us.
Kararan ribe nyo mauni yu kiamite referral. Kokitoret ang nyo keribo kabisa kiwecho ne kararan anyoru kerichek eng oret ne kararan.
What are the other things that right now are important to her that we can be watching or be monitoring?
Yeah.
The things you're thinking about, or what are the things?
Iya, pangalega apa kot lagu benka, apa isun tung joy.
Tawatinya na buati lagu. Atulo ine na bawa buatu tu habla.
Lagu benka.
What exactly about the kids at home?
Neng bu no missing over lagu benka.
Hapu ini lo sama school.
So it's mostly school that she thinks about, that her kids, that her kids will be educated.
Yeah.
Kuna watoto watano?
Yeah, 5.
Ini Jimmy Bofo.
Jimmy ka kong man? Angkat
Kitungo mo ko ulin magtalo.
In a case like this, you know, for her to go back to the community without having caretakers to be able to provide what she needs, her suffering could be so extreme right now. And that's really the case for so many in Kenya, that they don't get a place like Kimbilio Hospice. They are in the community, and it's so difficult to take care of them that it really can provide a really rough end, not only for the patient, but for the family that loves this person and has to watch that suffering.
Because the children came here with the husband.
Right.
Yeah.
Hata makikweli lakwani? Kikweli.
Labda siku ingine watarudi kutembelea
Tena.
sisi tena.
Asante.
With certain kinds of cancers here, they don't actually do any treatment. And it's estimated that at least 80% of patients with cancer, by the time they show up at a hospital for any kind of diagnosis, it's already stage 3, stage 4, so advanced that curative treatment is not a likely option for them. The family really wants for him to go back home, but his pain is not controlled. So I think if we can get his pain controlled even in the next couple of days, we can send him home.
Barnaba, ikase ole mito ole ikase kwamin?
Golen kongalal kumangita.
In palliative care and hospice care, it's not only about the patient, the family is also very important because they're affected when they have a sick person.
He's in pain and then he's distressed because he's coughing up blood. The plan is to relieve pain, and I started morphine immediately.
Research shows a lot of patients with life-threatening illness can tell you that a lot of the healthcare workers do not give attention to their pain. We do have maybe 50% of patients within the hospital who would tell you they are in pain.
It isn't until recently within hospitals in Kenya that the issue of pain has even been really brought up as an issue. You know, in the US, it's one of our vital signs. It's one of the things that has to be measured every few hours. And here, it's something that's often overlooked. It's improving with hospices coming up and different people advocating for it, but still a big challenge in many of the district hospitals and many of the government facilities. There isn't access to pain management like morphine, which is considered an essential drug by the World Health Organization. And so what we often find is patients discharged to us from the hospital and their pain is just completely out of control. And what's amazing is that it's not usually so difficult for us to manage. With simple drugs, they're not so expensive. We can, within hours, have a patient much more comfortable and able to rest than when they arrived. I first moved to Kenya in 2004, we were in the community doing a lot of HIV work, but it was mostly just visiting people in their homes. I was really passionate about caring for people living with AIDS, but I'd also come from a large hospital in Los Angeles where we had access to every treatment available, and here I didn't have that. When we finally discovered that there was HIV treatment and testing available in a little town called Turbo, we began each Friday to take patients.
Mimi naitwa James Kimre na niko na nilisaliwa 1983 mpaka saa hii.
Sasa kibanda nakakenya okenya kowala. Sasa kitenungana meborwa kole uyo. Yani kabetwa yote kwa sababu chita mzima. Sasa makikasirchinye clinic kuendi olini. Na yani kabetwa sin kole weta clinic. Kari lion borta anan une atepto ilo. Meborwa kole
Nearly every family is affected by HIV/AIDS. If the mother is not affected, not maybe the husband, or maybe the child, maybe the grandfather.
Me, my sister, meet my sister and my brother, or meet the brother again, and family, the families. You see? Then you go to young. This line. Monani. Lakini discussing, kita nagosta guitar. Kusabi. Kukonge ako kondeke freedom ni ba ule uni da ngai ji mai ta tare ngai na yusuf ta mele.
His condition's been deteriorating, and so this morning he had a stiff neck, which because his immune system is so suppressed, then it can be indicative of a type of meningitis that desperately needs treatment beyond what we can do at the hospice.
How are you, James?
Kita na tim kita na hari, kan mama je koyan boleh man guni. Aso wendi got ko buat boleh oh marah sih, marah.
Notice his weight has gone from 68 kilos today to 45 kilos. He's wasting away. He's got zero immune system, and he's got viral loads that are sky high, which means these drugs are worthless. They're all spoiled. And so he's taking meds, but he's not on meds. That's no different than a glass of water. Oh, I know, it's too late. Those are gone. A CD4 of 9 is the same as a CD4 of nothing. He has no immune system at all.
Anything under 200 gets classified as AIDS, but with his being so low, there's certain, we call them opportunistic infections that can come up with a CD4 count that low.
Is he vomiting?
Yeah, vomiting.
And has he been vomiting while he's been with you?
Yes.
Kimberly? Well, with that massive weight loss and vomiting and so forth, it's likely he's obstructed. Let's put him up on the table. Uchungu. Wapi? Wapi? No, I don't like that. Chungu.
I wouldn't know chungu.
Okay. Let me just listen. Oh my goodness. He's obstructed. He's still splashing. He has to go to the hospital. I'll call someone, but he needs a lumbar puncture. He may well have meningitis, and he's got outlet obstruction of his stomach, and for that we're going to have to do endoscopy. But he needs to be on lots of IV fluids. He needs a lot of work, and we can't do it here in the village. Okay, see if he's willing to accept what we're going to do.
Lakini daktari alisema unahitaji kuenda Eldoret, wanahitaji kupima shingo na tumbo yako.
Okay.
The fact that he puts his hand when you flex him back there worries me that he's got meningitis. He's totally obstructed. You can't give him any medicine. He can't eat. He's starving. If he's got meningitis, he's going to die.
Yesterday, he didn't look like this, so I think he's just deteriorating too.
He's going right down.
Right.
I'm just glad we got him today. We can get him in time. As desperate as these situations look where people are so wasted, no GI tract and probably a fungal meningitis or whatever, still, it might surprise you a year from now. He'll be dancing down the hallway asking if he's got any jobs for him.
Sure.
Only because we have our hands on him.
Right.
We don't have our hands
Right.
on him, we lose him.
Do you want me to go check and see if there's a car that's going to be here?
We'll see if they have a vehicle. If they don't, then I'll speed things up as fast as I can get done, and I'll take him to casualty.
Okay.
And I'll call ahead and make sure that people in the wards know he's coming. And, you know, we've had problems. We've had people like him turned away from the emergency room. So I like to go inside with them. And I find the nurse is very reasonable as soon as I put my foot on her throat. And then we just start discussing it logically. And then we get to the right answer. I'll have him to come back in 2 weeks with this, play with that date as a hypothetical date.
Mi nataka nipone na niendelee na kazi yangu kama kawaida. Hii ndio tumaini niko nalo. Sina huko tumaini lingine na kwa Mwenyezi Mungu.
And he has a succussion splash, so I think he probably has outlet obstruction or atonia or something. So we can't give any medicines. And he's got headache for 3 weeks, and when I flex his neck, he points to it. It's not stiff, but he points to the back of his neck. It's hurting. So he may well have meningitis. He's so immunosuppressed. He's lost about 15 kilos. He's very dehydrated, needs saline resuscitation, GI workup, and a lumbar puncture. All right? Okay? Thanks, buddy. Bye-bye.
Thank you, Joe.
See you, buddy. Is anyone home?
Mostly government hospitals are so crowded, they will not take in a dying patient. They would rather give the deathbed to an acute case where the patient is going to get well and go home. People would bring a patient on a stretcher, really a very sick patient, but because it's a patient who has got advanced cancer and is dying, they would not be given a bed in the hospital. Probably people saw it as a burden. This is a dying patient. Why should we have a dying patient? They should just go home and die. You know, it was like, go home and die. We don't really care what happens.
Okay. I was actually on my way back home, and I just received a phone call from Professor Mamlin, the doctor who does the HIV work. So he's requesting, there's 3 surgeons who are in Eldoret right now. One is the head surgeon for a large hospital in US, and then a second is also a surgeon from the US. And the third is a surgeon from Nairobi who is a specialist in repairing when wounds won't heal by themselves, especially for people who are paraplegic, who are paralyzed. What they do is they usually take a piece of skin and then they graft over to close the wounds. So those 3 people are available to meet you tomorrow in the afternoon.
My name's Jacob Ananda. My life was good before I was shot because I was able to feed my family. I was able to educate them. I was able to take care of everything. But since that time, things have changed.
Very soon you'll get.
She's working herself. She's trying to look for food by herself and other things.
It has been tough, very tough, because He has been our breadwinner. We used to help each other. He was going out to look for us, and I was here to manage the home, the farm, kids. So I'm the one who is supposed to take care of everything. I'm the breadwinner. I have to take care of kids, have to manage the home. So everything is on me. Yes, it's very tough.
There were several consultations with doctors who had seen Jacob's wounds, and everyone said he has to have skin grafting or some major type of procedure or surgery. And yet, it's not like that's just available. You know, you have to search it out. So what I wanted to see is, if you're willing, I would go with you tomorrow and go to the hospital to meet with the 3 doctors so they can evaluate you and make recommendations.
Yes.
Is it okay?
It's okay.
Okay.
It was on 7th July. It was around 3:30. When thugs came in, they knocked on my door, they broke it, got inside. Then they demanded what they wanted. So what they wanted was electronics. So I gave them. One of them told me, this is not enough. He shot me, then he went.
Where were you shot? Can you show?
Yeah, exactly here. Yeah.
Can you show me with your hand, explain where you're paralyzed from?
From exactly where it passes through.
Up. Good. 1, let's go. Come up. Up. 2. Great.
And it was good because it was a school. One of the boys had. So he heard me screaming. So when the boy came, he alerted others. Then they organized for me the taxi to take me to the hospital.
Take it like this. Up. Good. 2. Let's go. In. 3.
Government hospitals, they don't attend to people very fast. So it took time. I stayed till the morning. At around 8, that's when they started attending to me.
I just wanted to come back and tell you so that you can prepare, you know, to go for psychologically
Yeah, sure.
for a small safari tomorrow.
Yeah.
What's usually a challenge for patients like you is that the wound is so dirty, they can't cover up an infected wound. But you have clean wounds now, so it's
Yeah.
not a matter of infection. It's that they're so deep they can't grow back themselves. So that's why I was telling you, one of my goals for 2013 was to see how to help in this situation. Really, Jacob, there's so much left for you to live, and I don't think it's here in the hospice. I want us to see the best way to get these situated. Okay? One of the things that Living Room we've always done for our patients is we advocate for them. So often I think our patients arrive and they're not listened to in other places. They don't have the voice, and they need that. And so one of the things with Jacob is that, you know, he's been here for these months, and there's these next steps for him to be able to go home that have to take place. And if there wasn't a team advocating for him and arranging with doctors to meet, he wouldn't be able to have them. And we've seen that so many times. Just the need to fight for justice, the need to fight for these people who've become a part of our Living Room family.
So, good. 28. 29. 30. Good.
one of the things I've learned over the years is that in caring for patients, we can treat their pain, we can do these symptom management, provide social work, but if we don't care for the things that matter the most to them, then our job isn't complete.
Urana Margaret Wait Kimber, Hatindai Labo Mut. Keo Alaga Mogi Kaya outside the Gavon. Keep Kitcheruin Metoi Abandek, Pakenesi. Magoyoxen.
Maggie probably has weeks to months to live, and her kids have a lifetime in front of them. And so although we're a hospice and, you can't help everyone, at the same time, you do have to be very sensitive to the people who are in front of you and what is possible. To get to Maggie's home from the living room, it's about a 2.5-hour drive through just crazy road conditions.
Dokwa mete ako tukwa sukaman ke baru ai chotok pa pichotok chuige chupai. Atarti la ko choko kasu.
I accompanied our social worker to go in to pick the kids up because I also wanted to see their home. I wanted to see where they were coming from. Jamge. Asai. Jamge. She's gonna show us your house.
I want to introduce you to you.
Yes.
This lady called Salina. Salina is a good neighbor. She's the one who has been taking care of this.
It's a beautiful thing to watch community, even in the midst of all of the challenges and the suffering that they still endure, to have people who are willing to stand in the gap and make sure these kids get to eat and make sure that at least they're okay for today. Unataka kujua majina?
Nataka nijue majina hapa.
Yeah. Mimi? Naitwa Julie.
Julie.
Julie Boyd. Unaweza kusema jina lako?
Unajua Kipto. Kipto Gelfin.
Kipto Gelfin.
Na huyu?
Nasema yako. Naomi Chirchir. Naomi Chirchir.
Naomi Chirchir.
Naomi Chirchir.
Haya, na ya huyu sema ya huyu Kipto.
Huyu? Michelle Paulina.
Michelle Paulina. Na huyu mkubwa?
Huyu? Moon Dennis.
Moon Dennis. Nani mkubwa sasa?
Mimi.
Alafu nani?
Hakuna mwingine.
Hapana, alafu nani?
I go into homes like this from time to time, and I still think that when kids are hungry and suffering and there's not an easy way out, I think it should make you feel a lot of things.
Hello. Karibu. Unalala hapa?
Haya.
Kipto. Unataka kuenda na sisi kutembelea mama? Hospitali?
Mimi nataka.
Unataka? Na wewe?
Nataka.
Na wewe?
Tamini.
Hata Amen? Sawa sawa. Well, I'm not sure really what to think. Imagine what it's like for Maggie to know where her kids are. It just makes more sense to all that she's talking about as far as, the hopes that her pain is controlled, but she knows where her kids are staying. She knows the challenges that they're continuing to endure on a daily basis. Oh, no one is baridi? Can't really imagine what that's like as a mom. I think I'm overwhelmed too because she looks just like her mom.
Masikini nguno mamito toreti netosip kotoret komostab sukul amu ndakini kotindo mbarenyi tamuch kokeikei. Asa boisioni yoe kidogo ko notok nechoyoe kolya koisub kwala amitwogik kolipane kot nito menye icheket.
Margaret sochini Jehova kotoret ngolo ako tartai kwek.
Na ule mzito, simama. Ule mzito. Chana kidogo. Sasa ndio mzito zaidi. Pole.
Wow, I feel like this is not so good. This is not so good. Anyway, I've seen such issues, but it was like that one was so terrible. The way I saw the house, there's no anything to cover the house downwards, the way the kids are sleeping. I feel it. Yeah.
This is a picture of what so many who are suffering with HIV or cancer, that they die in these environments without, any chance for getting pain control or any chance for getting medications or the support that they need. When you go back to 2 days ago and you asked me what happens to these kids next, I still don't have the answer, but there's a whole nother picture in mind when you hold their hands and you see where they live and the lives that they have, and it makes you unable to walk away and not care.
Pole.
Ngoja Michelle.
One.
Ngoja hapa
Kidogo. Kidogo.
Okay, good.
Mkono huyo. Be. Yes, yeah, hivyo.
Naomi.
Haya. Angalia mama.
Toa. Na mama. Kaa chini. Na mama. Haya, penda mimi. Penda mimi. Penda mimi. Penda mimi. Kipto na wewe unipende? Unipende? Mimi mkubwa. Upendi mimi? Au mimi kuja unipende? Asante kwa kutuleta kuona mama. Bye tu. Ko saidia kwa kidogo. Suna ni beba. Asante. Ndio mama yake. Mama yake mmoja.
Because I had been working within the community and would go on home visits on a regular basis, I would often come across cancer patients or people living with HIV and AIDS who were experiencing all kinds of pain and symptoms that we didn't have access to any kind of pain medication. It just wasn't available, it wasn't affordable, it wasn't something that the patients had any access to. So people were in the villages suffering, and it just felt like enough, it doesn't need to be like this. There was a couple of specific cases that awakened, I think, my heart and my mind to just how extensive the need was. I had gone on 2 home visits in one day to visit 2 children. It was with one of our social workers that I was working with at the time. And the first home was of a 2.5-year-old little girl, and her name was Flovia. She weighed about 12 pounds, and she was HIV positive. I found her lying on the floor of this little kitchen. It was a mud hut. She was dying. I was so moved by her, by her little life on this floor, and thought, I think we have to do something different than this. So, she was on the verge of starvation, and there were, many other contributing factors because of HIV and her being an orphan. But I went from her home to a second home of a child who was 14 months old, a little boy, very similar situation, HIV positive, again, severely malnourished, and just these little bodies and their arms and legs so wasted. And I just held him in my arms too and asked the question of, what does it look like? What does it mean to love in this situation? I came back from those 2 home visits that day, and I sat with David Tadrous, who's one of our national leaders, and another friend named Allison, and we just began to discuss the situation, and I just remember Allison saying, well, let's try. Let's try. And so we created this little treatment center in the clinic with 1 room and began to feed these babies every 2 hours.
She was really, you could think this child, we were waiting to be called at any time in the middle of the night that she passed away. But there was a secret. I think when you give somebody a total attention, and you do what is in your scope, and give your heart and attention and focus that person, something happens. And at the end of the day, we call it a miracle.
We did that for weeks and weeks, and after 6 weeks, little Felix, he went into respiratory distress, and he died very quickly. It was a painful loss because it was one that, we had so much hope and desire that it would be a different outcome. But we watched Flovia thrive, and she did learn to walk, and she began to speak 2 languages, and she would call everyone Mom, Mama. So she would call all the men, all the women, anyone in her life, Mama, because we were the people who were loving her and taking care of her. After a few months of care, she was able to go to a children's home, and now it's all these years later, and to watch the life that's still in her is quite remarkable for me. That experience of taking care of those 2 children, one that passed away and one that came back to life, very much represents what the living room is, where hospice is so often associated only with death and end-of-life care. I feel like we have a unique opportunity just to provide care, that we leave the outcomes to God. They're out of our hands, but as far as us doing the best with what we have in this place is what Living Room is about.
The name of the patient is Barnabas Chepto Keegan. Diagnosis: CA-esophagus with actually a brain tumor. Pain has been controlled, so it's not in pain. So he came in when he was in some degree of pain, but that pain is no more.
The challenge for him to go home and be cared for within the community was that he would have been suffering and in pain. So in coming here, that can be controlled. We teach the family, and then once that's in place, because the family wants him at home and it's a good place for him to be, then he can be discharged, and for however long he lives, that it will be a place where he doesn't have to have the same level of suffering that he would have otherwise had. I think that palliative care is often seen as just managing physical pain alone. But if you really look at what it's supposed to be, it's a holistic care model where you're looking at the physical, the emotional, the spiritual needs of patients as well as their families. Palliative care really is, how do we relieve suffering? How do we improve the quality of life? It's not necessarily going to lengthen their days, but to improve the quality that's within them.
The family has just called, the wife has actually called, and they are waiting for us.
Even though he's going home to die, it felt like he was going home pain-free. His family knew that he had been cared for here.
So they are saying they are happy to receive their father, and Eunice, the wife is saying she's also happy to receive the husband back home. I wish we could interpret what could be going on in the mind of Barnabas, but always when somebody is at home, home is the best.
Okay. So asubuhi, saa sita, saa kumi, usiku hata meza mpaka 2. Na akianza kusikia uchungu, utapigia simu ya Marogo na tutaamua meza zaidi. Weekly, we'll be meeting up to be able to provide his pain medication and give that to the family. We, by phone, can be reached anytime if they have questions. We can give advice or encouragement. So those are some of the things that we'll continue to do with Barnabas's family. People come and they're cared for, they're listened to, they're given a voice, and at times when their dignity has been lost, we get to be a part of restoring that, and it's through a lot of patience, a lot of attention, a lot of care.
It's one of the biggest challenges, seeing death every day. What keeps us going and keeps us coming to Kimbilio every day is the fact that I'm coming to assist somebody, even if that person is dying. Yes, but die in dignity, die pain-free, die in peace. And by giving out that service, I feel like it's something that makes me wake up in the morning so that they don't die suffering.
When patients like James come in and you look at them and they're terribly sick. Years ago when I was just starting out doing this work, I often felt like it was the end for these patients, but there have been people who we've journeyed with, and through really difficult situations, we've watched them come back to life.
The future for James. The prognosis by then, as I left him, was not so good. But again, if you can come out of the meningitis and the obstruction and accept to take his drugs, well, still it is bright. He can still live long, more days on his meds and go back to his duties.
You know, there have been days where I go and I'm looking for a specific patient and they've already died and we just don't know of it yet.
Habari yako?
Mzuri.
Nilikuja kutembelea wewe.
Nikitapika.
Unatapika?
Nimekuwa sasa kwa siku
Oh,
mbili.
good. Wali...
Naangalia kila kitu.
Aha. Walisema nini?
Nilikuwa sasa nafikiri wataleta kila kitu kwanza.
Kutapika imeisha lakini unasikia
Pata kuna hiyo lakini si sana.
na baba alikuja kutembelea.
Alikuja siku mbili. Sasa haya.
Sawa.
Asanteni. Nimefurahi. Roho yangu hata imependa.
Yeah.
Asante.
Hata sisi.
Sasa nimeona nimetulia sasa niko na watu. Asante.
Asante pia.
Sasa
Barikiwe
haya hata mimi.
na bado tuko pamoja.
Sasa.
Sawa.
Haya.
Asante.
Haya.
He was asleep when we first saw him, sharing a bed with another patient, and just the conditions sometimes at the hospital can also be very overwhelming. But I was encouraged that some of the tests that he needed, they've been done, that there is progress as far as trying to get him treatment. It looks like he probably does have meningitis, and so we'll need treatment for that, and then we can follow up from there, whether he will come back to the hospice or be well enough to go back home, and then we'll also follow up in the community.
Mama tumaini nengung ile alia ngao yao kule iba alia
Since I came this place, there's a lot of change. The care given to this place, at least I have friends. There's a lot of guiding and counseling.
You put one pillow on this side?
And at least that one makes me happy. And it makes me enjoy at least.
We'll count to 3 and come up, and then go in, okay? 1, 2, 3. It's exciting to me to think about the possibilities of this surgical team assessing him and us thinking about what, you know, could be as far as getting him surgery to do the skin grafts and those things. And even it's outside of a normal scope of what a hospice does, and yet he's become one of us, and I just feel like there's still so much ahead of Jacob. And so my hope and my prayer is that we'll know kind of the next steps of what is needed so that he can go back home. Even though he's going to be limited because he's in a wheelchair, his mind is so sharp.
He can counsel me. You see, when he's on the wheelchair, I have planted some sweet potatoes outside there. when there is a cow destroying the sweet potatoes, I think he'll even chase, or he'll signal me. Or if anything is going wrong, I think he's there to protect.
This doctor is from Nairobi. So, and then there's 2 other doctors. So I think we can try to go inside and then you can meet everybody.
Yeah.
Okay.
There's a place to go, or if we can just go down here where that tent is.
We
or-
shall. We have a clinic here,
Okay.
so we can get a bed.
Okay. All right.
2.
I don't have any worries. I'm just ready for anything. Yeah.
So there's just some granular tissue on the bone, is that? Yeah. Do you have the impression that this one is evolving, like to close, or not really? Stationary?
It's pretty stationary. There's 4
It
of
would be
them.
difficult for this one to close because there's a crater in the
excavation.
Yeah.
So he came to us basically. They were much larger than infected, but
Oh.
they're not
Yeah.
going away. They're a bit deep also, very deep.
They're also clean. They are all ready for closure.
They would be, wouldn't they?
Yeah. The only thing is you have to do it in stages.
Is it complicated?
The surgery.
Yeah.
No, the surgery is simple surgery. It's not complicated at all. In fact, I hardly use blood unless the patient is anemic.
Because I thought my body is still weak. So I don't know.
You are quite strong when I look at you. And some of the nutrients you are losing, you lose them through the wound.
Oh.
And your wounds have been well taken care of.
Yeah, they are really taking care of them.
Could
We are very
easily
good
close them,
caretakers.
close them and they will heal nicely.
We just come out of MTRH where we were meeting with a couple of surgeons, and they were able to look at Jacob's wounds and say that it's possible to do these flap repairs, which are so important. And so I don't know how Jacob's feeling, but I'm feeling really hopeful and grateful for their time.
I feel the same.
You do? Yeah, me too.
I feel the same.
Because I think that it's been a long, long road, and
Yeah.
so
Maybe there's some hope.
I think there's some hope too.
Yeah.
How are you feeling?
They are going to heal.
They're going to heal. They have to do it, each one separately. So they have to do one first, let it heal, then we wait 2 months, we do the next one. You know, it's going to be a lot of work, but at the same time, because they're not going to close on their own, I think that's the best solution we have for now.
Yeah.
It's probably going to be somewhere around $2,500 for each surgery and the hospital stay. So probably a total of $10,000 is what we'll need to do this. There's always going to be challenges with finances, but I don't think we should have those be what determine what can happen or not happen. And so I don't know exactly where the money will come from, but I trust that it will be provided and we'll walk this thing out. 2013, we got to get rid of these wounds. What do you think for 2013?
I think they are going to heal.
They're gonna heal.
Yeah.
And for you?
Before it ends.
Before it ends.
Yes, they're going to be ready.
Yes.
Elfin Kipto, Naum Chepchirchir, Michelle Cheruto, Aimon Krui.
In conversation with Maggie, her desire to see her kids, just continues to resonate. And as her condition deteriorates, we just really felt it was important for her kids to have another chance to come and to see their mom, for her to have a last chance probably to be able to see them.
Abaibai kabisa amu kimongen ale itu lagok asa ko abaibai kabisa amu kwaro lagok emi tugul. Istoge kabisa makase nguno kotokoimo kwoin tai. Abaibai akere icheket ale kokoiyokwo mameng'wa siling 100 ale kekwam akichek eng furaha nekwotinye eng roho yangu.
We arrived, and the first thing the kids did was they were able to go and see their mom. But then there's the basic needs. The kids, were filthy. They needed to take a bath. They needed to be fed because they were hungry.
To their linens, which is clothes, they were very, very dirty, and they had some small insects, which when somebody is not making himself clean, those insects come up out of that. If they are sleeping in a dirty place, it come up creating those small insects. Some days back, I had those insects, and when I saw them, in fact, I just reflected the kind of life which I had been living.
Kongen is ale masikyin amu kotindoi boisionotok asa ngokometo boisioni komami kiy netorete bichu.
Actually, the family are living in a rental house. Wherever they are staying is rental. They pay some amount of money every month, and that makes it hard for the father of the kids, because he has to look for money to pay that rent and look for money, provide food, and whatever other basic needs. It is not out of his own liking that the kids are not in school. Whatever he's getting as payment of the casual work is not enough to really be spread to cover all the needs of the family.
Leta toa uniweke hapa toa. Salimie. Beba yeye akuje juu. Aya. Toa. Nyorosha miguu yako. Nyorosha. Kuja hivi. Wacha doli hapa. Salimia mama. Kuja. Salimia mama. Salamia mimi. Naenda nyumbani kwa baba. Wenda usalamia baba. Ayapenda mimi. Basi shuka sasa. Misha. Kuja juu. Tengenezea Michelle mguu yake ikae mzuri sasa. Nataka apende pia yeye. Leta mkono. Nasema kwenda nyumbani salama. Usalamie baba. Asipende. Haya. Asa Naomi, hata Michelle. Naomi. Kwa nini unataka kulia? Naomi, usalamie kwanza. Kwa hii mkono. Ukae mzuri. Uende nyumbani salama. Usalamie baba. Asi unipende. Haina watakia. Na TikTok pengi huyo. Kwa sababu ni mvulana. Nasema yeye ni mkubwa. Unapenda. Asa, Naomi, mwende salama. Mungu atawabariki. Ambia mama bye. Fanya hivi. Fanya hivi bye. Bwana nikuja. Sisi ndapona nitakuja. Na mwende kanisani. Sawa?
So many of the things that we do and the work involves things that feel impossible. With Maggie's kids, you can look at this big picture and have no idea where to begin. What are the right things to do? Some people can say, There needs to be development, there needs to be relief. I think our experience is a combination of both. It feels like providing clothes is the tip of the iceberg, but sometimes you gotta start somewhere and then continue to work through it to see the next steps. It's not easy, but it's worth it. There's a lot of pain in this process. There's grief for us. To continue to care means that you have to stay connected. When we see these kids who are suffering and who are in these horrible conditions, like you can say, I've seen this before. Or you can say, I've seen this before, and it still moves my heart in ways that I know I need to respond. With Living Room, one of the things that has been true since we've begun is that just because a patient passes away, it doesn't mean that the care for the family ends. With Maggie, at some point, cancer is going to overtake her body, and yet her kids are now a part of our family and a part of the work that we do. It's one thing to care, but if that doesn't lead to some sort of action, then you need to question what you're doing and who you are. There's immediate needs of food and clothing and blankets. The bigger picture is over time looking at schools and how to help to make sure they're gonna get an education. And those are some of the things that we're working with through our social work team, looking at resources within the community to be able to partner to figure out how to care for these kids. There's a quote by Mother Teresa that says, if you love until it hurts, that there's no more hurt, there's only love. Now, while I have a lot of respect for the work that Mother Teresa did, I just have no idea what that means. I think our experience here has been much closer to that if you love until it hurts, that it still hurts, but it absolutely matters that you love. And with our staff, that's what we ask them to do every day. They're coming and they're giving their hearts and their talents and their gifts and their time away to people who are dying. And sometimes you ask, why? Or, how do you keep doing it? And I know that part of it is that we're doing it together. Part of it is that it really does matter and that there is something life-giving about it. But it's not easy. And I think anyone who were to say that it were, they're not being honest. But there's something, for me that, it really is a journey of faith. It's a journey of believing that God is in the midst of this place. I don't think my journey has been as much about Africa or hospice work. I think it's been a journey of me loving people, and that can be done anywhere.